COVID-19 has created an extremely difficult situation. More than 5 million people have lost their lives. More than 300 million people have been infected by the virus. We still do not know what's going to happen next. We're dealing with the third wave of the virus. But virus is not the only thing which is harming people. The misinformation which has been associated with the COVID-19 has really damaged us at so many levels. It has created misinformation. It has created vaccine hesitancy. It has led to people believe in a lot of harmful information. At DataLEADS, we have been monitoring the content from the last 2 years, essentially about COVID-19. A team of ours has went through thousands of videos, photos, and different kinds of content in different formats and languages, just to understand and identify misinformation so that we can debunk it, so that we can understand what's happening in a better position to see how people can be protected from the onslaught of misinformation. Misinformation started early. It was still Jan 2020 when we had this news that there's some certain disease. We still had no idea what was happening in Wuhan, which has circulated, and people are getting infected by this particular disease. And there was a doctor, Dr. Lee, who was perhaps the first person who went out and said, no, people are falling sick and there is a viral disease in the town. But he was immediately arrested by the local authorities, and then he was forced to sign a kind of a document saying, no, these were just rumors. That's how the first phase of misinformation started with this particular virus, with this pandemic. And one of our colleagues was the first one. She'd reported on the incident, what was happening on WeChat, where the whole discussion started about Dr. Lee's death after that. And we saw the first onslaught of misinformation, essentially related to Wuhan, essentially related to Dr. Lee. But then after that, it just went across the world. Then the different things and different interventions of different people and vested interests led to a huge wave of escalating wave of misinformation. So one of the key things which have been, we have been monitoring over the last couple of months has been a lot of misinformation about vaccines, particularly after the boosters were introduced now in so many different countries, also in Asia. We see a lot of misleading, false information related to vaccines, pushing people to not go for vaccines. Most of this content is in local dialect languages, or is done in a way so that people can fall for it. The visual element of it, the way it has been sophisticatedly created, either in the shapes of memes or in other format, but essentially to mislead people about vaccination. We have seen that there has been an attempt and a campaign to target kids and their parents, so that they don't allow or they don't go for vaccinations. So we have been seeing deliberate lot of content created with a lot of sophistication on social media to mislead parents, to create a fear that kids do not really need it and they may get infected otherwise if they just go for it while getting it actually. So a lot of misinformation related to vaccines is moving slowly towards targeting kids, targeting children, and targeting their parents. A lot of misinformation also essentially related to the religion. People have been identified with a particular religion or a race, and they have been targeted. We have seen Chinese workplaces, restaurants, other businesses attacked in so many other countries because it was believed that they are the ones who are responsible. We have seen in many Asian countries there has been uptake in Islamophobia. We have seen that a particular group within the Muslim communities were held responsible for spreading the virus. We have seen a lot of social media content where mosques were identified as the source of the virus. We have seen content where the images and photos and videos are uploaded saying that no, this particular community deliberately spreads the misinformation. So this is huge and this is massive. And what we are seeing as an emerging trend actually is that huge content actually, which is misleading, harmful, circulates online in local languages. It's not essentially in English. It's in Tamil, it's in Malayalam, it's in Hindi, it's in Bahasa, it's in Bangla. Lot of misinformation, lot of videos, photos which circulate online, which mislead people actually, are in local languages. And the problem is that there's very less effort or intervention to monitor or to identify this content which goes in different countries, in local context, and in local languages. So it remains unchecked. We are also seen a lot of content actually which originates from Europe, because there are strong lobbies which work against the vaccines. So majority of content which comes vaccines, it emerges from Europe, and then the way social media functions, that's where internet functions, the content flows to other countries, and we have seen that happening with vaccine, particularly to India, to Bangladesh, to Sri Lanka. The theories which have been propagated in Europe, people find them here, they use that same source of knowledge and information, and they create content in local languages to mislead more people. So it happens very at a coordinated level, say in Europe, for example, but then when it reaches here, individual people who believe or tend to believe in these different unscientific theories, they create this content to mislead people. We have also seen a lot of misinformation circulating in closed chat groups. But there's a lot of focus on social media, on internet, but what happens in chat groups remains, hidden behind family groups, within community groups, within local society groups. But these are very powerful and damaging conversations which happen out there, because if one content goes out, nobody checks it and nobody knows what's circulating in those community groups actually. And with COVID-19, again, we have seen majority of content which circulated in terms of which was fake and misleading was actually circulating in closed chat groups. And because of the nature of these chat groups, we really do not know what is happening. And we see this as a emerging major threat actually for a long term for public health, because everyone is in a chat group. Everyone is in one or other different platform where they are part of this network. And they really do not have understanding and competencies how to identify what is wrong and what is good information online. We also saw a lot of information which is being circulated in the last 7-8 months essentially was in an audio format, particularly with the one app which became so popular in all across the world, essentially in India, that more than 5 million people downloaded this app just in a year last year. And there were thousands of sessions happening online on that app. And the problem was there that there were no footprints after the conversation is over. So whatever you are sharing there, which was essentially a lot of anti-vaccination content and a lot of things which were harmful, which were unscientific, there was no footprint, and you can't go back and check and identify and fact check that information. And we see, given this app is still popular and a lot of other audio platforms are very popular, we see little effort also to check this kind of particular misinformation. The problem is also language, because audio gives a flexibility of talking in local languages, so it remains a very powerful space where we still do not know what's happening, but it has been a source of a lot of misinformation. But there was too much focus on COVID-19 and vaccination. There were a lot of misinformation about other deadly diseases like cancer. There was huge content which is created to mislead people about cancer cure. And we don't know why cancer attracts so much misinformation, but it is actually a huge wave of content which is created to mislead people about the treatment of cancer. Like as bad as bogus as that the donkey urine can treat cancer, as bad as a black virgin cow urine can treat cancer. And these contents, these videos get millions of likes on social media, and we still do not know why this is happening. But this is a major emerging trend, which is a trend which is essentially not related to vaccines and COVID-19, but related to a lot of other diseases. We've also seen data inaccuracies fuel misinformation. In a number of countries where there were no local information, timely information available to people, we see that actually as a major source for the misinformation to circulate. And we have seen also in case of in India, for that matter, when there was information was lacking, there was not timely information available to people what to do next, what's happening, misinformation came around and it circulated the whole debate. And one of the world's most prominent doctors, Dr. Prabhat Jha, has already recommended that, when we do the next census, we should include a question about like who died in your family during the COVID-19. So we have an accurate understanding what is really happening, what really happened, so that we move forward as a more informed society to take decisions which are based on science. Because what's happening here, that the people who really want to mislead people, they're taking advantage of everything to mislead people. Like, for example, we're seeing the official stamps of big major global organizations, of government departments, of senior authorities have been misused, fake ones created to mislead people. Letterheads of organizations, advisories from different departments, from different major organizations, very prominent organizations, were bogusly created to mislead people. We also see a trend emerging where celebrities are roped in to mislead people. And this is also extremely dangerous. Imagine a Tamil actor in India saying that, like the vaccines are not going to cure you. And then he has millions of followers on different social media platforms. So we see an emerging threat where celebrities or people who are on social media have a lot of influence may be roped in to mislead people in a one or other way. So, and also for a very strange reason, we see Bill Gates still getting targeted on social media with a lot of misinformation. We know in the 2019, then 2021, he has been consistently targeted on social media. And we see this again this year as a major trend where he may be again targeted. We're already seeing a lot of content, kind of old content uploaded again to target him and a lot of other people who are leadership, taking a leadership role at different levels, being targeted on social media, and that quite mislead people, in a quite big way. So what we really need today is a global understanding based on data, based on science, and a spirit of collaboration. So all of us come together, scientists, doctors, technologists, and journalists, because they play a fundamental role in terms of this communication space, come together to work together to understand how are we going to deal with this massive onslaught of misinformation. How are we going to calculate the cost? Because unless we understand the burden of this misinformation, we are not able to understand how to respond to it. The challenge is, for the first time in the human history, we are producing more information than we are able to consume. And that really creates new challenges for us.